orbit. Bony orbit contains an apex, base, roof, floor, medial and lateral wall. Apex. It is situated posteriorly between the optic canal and the medial end of superior orbital fissure. Base. It is directed anteriorly and is formed by the orbital margins. Supraorbital margin is formed by frontal bone. Supraorbital notch of foramen is present at the junction of medial 1/3 and lateral 2/3. Infraorbital margin is formed by maxilla in the medial aspect and zygomatic bone laterally. Lateral orbital margin is formed by zygomatic bone inferiorly and frontal bone superiorly. Medial margin is formed by frontal bone superiorly and frontal process of maxilla inferiorly. Roof is formed anteriorly by the orbital plate of frontal bone, posteriorly by the lesser wing of sphenoid bone. Roof separates the orbital cavity from anterior cranial fossa. In the anterolateral aspect of roof, there is a depression to lodge the lacrimal gland known as lacrimal fossa. Floor. It is formed by orbital plate of maxilla, orbital surface of zygomatic bone anterolaterally, palatine bone posteriorly. Floor separates the orbital cavity from the maxillary air sinus. It is marked by infraorbital groove for the passage of infraorbital nerve. Medial wall is formed by frontal process of maxilla, lacrimal bone, orbital plate of ethmoid, body of sphenoid. It is the thinnest wall of orbit. It separates the orbit from middle and posterior ethmoidal sinuses. Lacrimal sac is present between the frontal process of maxilla and lacrimal bone. Lateral wall is formed by orbital surface of zygomatic bone anteriorly, greater wing of sphenoid bone posteriorly. It includes superior, inferior, lateral, and medial recti. Origin. All recti take origin from the common fibrous ring of tendon of Zinn. This tendon encircles the optic foramen and adjacent part of the superior orbital fissure. Recti muscles runs forwards encircling the optic nerve and then the eyeball. Insertion. Recti are inserted into the sclera in front of the equator of eyeball. Superior rectus is inserted 8 mm behind the limbus. Lateral rectus 7 mm behind the limbus. Inferior rectus 6 mm behind the limbus and medial rectus 5 mm behind the limbus. Oblique muscles. It includes superior and inferior oblique. Superior oblique. Origin. Body of sphenoid bone, above and medial to the optic canal. Insertion. The muscle passes forward along the superior medial part of orbit and forms a tendon. The tendon passes through the fibrocartilaginous trochlea. It changes its direction and passes posterolaterally deep to the superior rectus muscle and inserts into the sclera in the posterior superior quadrant of eyeball behind the equator of eyeball. Inferior oblique. Origin. Anteromedial part of floor of orbit lateral to lacrimal groove. Insertion. Inserts into the sclera in the posterior superior quadrant of eyeball behind the equator of eyeball close to the insertion of superior oblique.